And so anybody that comes in after this, I won't be able to introduce them, but folks will maybe interrupt here and there with questions. And then at the end, we'll make time for Q&A and people can introduce themselves um, then when they're asking questions. Hi, Tanya. Tanya's down in San Diego. Okay. Um, are you sharing your screen, Jason? I don't see it.
One moment, please. Go
Oh,
to security and privacy.
okay. Take your time.
Security and privacy.
And as he's pulling that up, I just want to do an introduction here to Jason Landver, who is the owner of Recovery Beach. I've known Jason going on 3 years now. I was introduced to him by Gregory Gouchon, a good friend of mine that I've worked with for many years, actually, in the healthcare space. And when I met Jason, he said to me that he eventually wanted to be able to provide services to Medi-Cal patients. And I said, "Oh, I've heard that before." You know, a lot of folks say that they really want to treat the Medi-Cal population, and then time and costs and reality set in, and it's very hard to get approved for by Medi-Cal, and you have to have the appropriate capacity and staff. So it's been an ambitious undertaking for Jason. I'm sure I can't imagine what that process has been like, but um, oh, he's popping back in. Okay. But I think it's important to know that um, it's when folks are first accepting Medi-Cal, they're operating at least a portion of their business at a loss, and it's hard, but the really dedicated are willing to do it, and very few do it. Many of the folks that we work with go to open houses and have gone and visited with some of the places, and there's a very clear um, difference between what you'll see in a Medi-Cal facility versus a private commercial residential treatment facility. The commercial treatment facilities have a much more home-like feel, while the Medi-Cal facilities have a more hospital clinical feel. They're a little bit more cold and sterile, whereas the commercial places, they tend to, feel like home. And there are pros and cons to both, but I think what's really amazing about Recovery Beach is that they really do have that feeling of some of the more luxury home-like facilities. They provide the level of care that is standardized by the state, so much so that they're able to get this credentialing by Medi-Cal. And now patients with Medi-Cal can experience what patients with commercial insurance experience. And usually that's additional modalities, more innovative treatment programs. So I'm really excited that folks with Medi-Cal have the opportunity to access this resource. And I'm just very proud of Jason, my friend, who was able to get this done. So Jason, thank you. Go ahead, take over.
Okay, great. You hit on a few strong points already early on, which is that our facility has been around for a really long time, about 20 years, and I've been uh, owning and managing it for the last 4 or 5 years. And we've only been working with commercial payers ever since the beginning of the facility, and mostly out of network. We have a few in-network agreements, but 90% PPO out of network. So we consider ourselves, and our clients that come visit Recovery Beach consider us uh, a very upscale, 5-star in every single way facility in terms of the accommodation, but also more importantly, obviously the clinical, the medical, and all the other services that we provide on a daily basis. So it is pretty incredible that we haven't changed anything, and we provide the same exact level of service to our Medi-Cal population, which is something that I'm not sure if anyone's ever done in Orange County. For the most part, facilities are either 100% Medi-Cal, in the sense that they only work with those with Medi-Cal, or they're 100% private. Not so many facilities have decided to go down the path that Recovery Beach has gone, which is to provide the same level of service to everybody, no matter who their payer is, whether it's the county or whether it's United Healthcare. So we're very proud of that. Initially, some of the in-house team and stakeholders were a little bit nervous about actually having different types of populations from different walks of life, and having, a YouTube executive in one suite, and, a rock and roll star in the other suite, and somebody who was homeless an hour ago in the other room. But actually the opposite, all the concerns actually never materialized, and actually the opposite. Everybody that had come in through Medi-Cal, first of all, they felt so appreciative to have this level of care that they've never, they may have gone to other facilities, they may have relapsed in the past, and they've never experienced a facility like Recovery Beach before. So their appreciation, and then it started rubbing off on some of the other clients that maybe have been used to, getting catered to, and 5-course meals and all the others, accoutrement that we're aware that this industry has in Malibu and Beverly Hills and Bel Air and all over the country, and ultra luxury. And we have those same clients because we target those same insurance policies. And so those individuals that are in our care, they start to feel more appreciation, because they're like, wow, the guy to the left of me, the guy to the right of me, they feel so lucky to be here. I should feel really lucky to be here too. And it's actually created an incredible vibe. So I'm going to give you a quick little tour, a little quick slideshow. We're going to go quickly. We're not going to keep everybody on the phone for too long today, because I know we all have a million things going on. But, that was just my quick sort of overview. But this is Recovery Beach. We're in the heart of Orange County. Quick, 1,000 feet view. We're 33 beds. So we're more of a social model recovery, where the residents and the clients get almost as much from each other as they do from the clinical team. And it's incredible to watch. We're not so large as a 100-bed facility and some of the just campuses out there. But we're also not 6 beds, where when it's 6 beds, there's 2 or 3 beds filled. It can be lonely, for a client that's there for 30 days. You're surrounded by the same 2-3 people every day, day in, day out. It can get boring, I hate to say it. But we specialize in inpatient detox and residential. We have a very high staff to client ratio. Of course, we focus on medication assisted treatment. We have an incredible medical team, incredible medical director, incredible nurse practitioners, and we have LVNs on site. We have RNs on site. We're very, very strong medically. Like, we're receiving some of the most difficult clients coming off of, fentanyl, and you can imagine, everything under the sun. And we're very, very strong at helping them detox in a way that, isn't agony. Of course, throughout the entire day, we have individual and group therapy. It's all dual diagnosis. We have psychiatrists on staff, and it's also holistic. So we provide the whole thing from sound baths to yoga to meditation. So we really go 360 degrees. As I mentioned, it's a beautiful facility. It's been completely remodeled a few years ago when we came in. Hardwood floors, brand new furniture everywhere, TVs throughout, a beautiful commercial kitchen that can seat all 33 people. And it's just very comfortable, very comfortable. There's no beach views, but we're 10 minutes from the beach, and we're going to the beach at least once a week for meetings and for circle, for outings. The outdoor space is also really nice. A lot of areas to sit, soak up the sun. We play music outside. when it's outside of group time. People are eating everywhere and just lounging and enjoying the California weather. And again, we focus on detox and residential. We don't do anything else. We don't have PHP. We don't have IOP. We are laser focused on one treatment modality, and that's 3.2, 3.5, and 3.1 level of care. This is all we do. And again, we've been around for a very long time, and now we're proud to accept Medi-Cal. And we're doing about 50-50 in terms of private pay to Medi-Cal. And it's been going amazing. So we're just, we're here today. We want to spread the word. We want College Hospital and everybody else that's joined us to know that we exist. And, we'd love to collaborate. We'd love to have everybody over for a tour. We'd love to, work with the community as much as possible so that we can be an integral piece in the continuum of care. And when somebody ends up in the hospital, when somebody, relapses, and there needs to be places to go relatively quickly. So after stabilization, and we can be that resource for everybody. I have a quick little video over here that I can share as well. That'll give you sort of a walkthrough of the space. It'll give you a better sense of sort of all of the outdoor spaces. Originally, it was built as apartment buildings in the 80s, but this location has had CUP to allow for inpatient and detox for the last 20 years. So it's really a location that's held tens of thousands. I'm even in the video, as you can see. So, we don't have to go on recovery. We completely remodeled the facility down to the studs, everywhere in the video. Here's me walking down after this. And that's it. So I'm going to keep it brief. I'm going to keep it quick, but I'm definitely open to any questions if anybody has, and we'd love to serve the community and love to serve Orange County at large.
Yeah, I want to point out too, and I'm glad that you showed the video. Sorry, I'm not crying. I'm just, my eyeballs
Yes,
are.
you are.
No, I'm not. Not very many programs have this sort of like apartment-like setting. I actually don't know any, and certainly no other program in our marketplace have that as a resource. And I love the fact that after programming all day, and I know you guys run a very tight program, people can kind of go and download themselves from that in a little bit more of a private setting, that they can go and process what they worked on throughout the day in an environment that feels like that's their apartment, that's their space, that's their place where they go. And honestly, because of the capacity that you have, you could have turned each of those apartments probably into a larger capacity for yourself, but the fact that you've left them the way that you have just leads people to feel like, I want this kind of independence, right?
Exactly. And the apartment, you're right. The apartment living is cool in for many different ways. Number one, it also mimics like where they're going to be further down the road. When they discharge and they go to a lower level of care, they're most likely going to be in a setting very similar to that. And then later, several months later, they're going to be with their friends, maybe sharing. It feels very much like familiar to each of the clients that are in our care. So it's not like they're leaving a $25 million Malibu mansion and then they come to this, place and it's so jarring. It's like, it's much more familiar, and it's homey, and it's cozy, and it's also not a hospital, and it's also not, clinical in the sense that it's, a commercial building. So it really does blend. And then every single one of the 8 apartment units has a living room. So it's a private living room just for those 4 or 5 residents that are in that apartment, just to hang out by themselves. So there's all these different zones, like you said, to process, to decompress, to, slow down, to whatever they're looking for. Read a book quietly.
I see this a lot. Folks go into these sort of like luxury accommodation facilities, and for 30 days, 60 days, 90 days, they're there and they're being waited on hand and foot. Meals being prepared, 3 meals a day, things being, housekeeping, and that doesn't mimic real life. It doesn't mimic what it's going to be like to be in a sober living, that's for sure. And most of these folks are going to need to go on to a transitional type of environment. I see Shani has her hand up with a question. You're muted, Shani.
Let me unmute myself. Thank you. Good point, Amy. And forgive me, Jason, I had to pop on another call, so I put myself on mute, but I didn't hear how long the program was. What's your average length of stay?
So from the commercial side, as we all know, between 3 and 4 weeks, they're really sort of pushing, discharge into lower levels of care. Medi-Cal runs very differently, where they allow 90 days.
Oh, interesting. Okay.
Of course, only if medically necessary.
Right.
But most of our Medi-Cal clients do not leave until 90 days. They like to stay as long. And truth be told, 3 to 4 weeks is too soon.
It is.
When I'm discharging commercial pay clients, I have to do it. I have no choice. Sometimes we keep them longer. We're not getting, doesn't matter. We're not getting paid this, just because we look at the clients, they're so fragile and they're not ready to go live by themselves in a sober living with minimal supervision, coming from a 24/7 monitored facility. But Medi-Cal, thank God, we know that in terms of reimbursement rates, it's a small fraction of what we normally, receive from commercial payers. But at the same time, they allow the clients to stay longer, which is most of the time in the best interest of the clients.
Of the client. And then that makes a lot of sense, Jason. And then do you have what is your payer mix? And how many Medi-Cal beds do you take a month?
50/50. So about 15 Medi-Cal and about 15 commercial.
Incredible.
Oh, okay. Interesting. And no HMO, right?
We are in network with Aetna and Blue Cross Blue Shield, actually.
So that would be the Magellan plan?
Yeah, that would be the Magellan plan, exactly.
Okay, that's helpful to know. And I want to round back with you, Jason. I'll give you a call. I'll try to find your number, Amy, afterwards, because I might have a couple. I don't know if you'll take a couple, but I might have somebody.
Yeah, put in the chat.
Chat.
Put your contact number.
Yeah,
Oh,
I'm
thank you.
typing that in right now, actually. Couples are challenging, but we're actually one of the people that specialize in couples. They never sleep in the same unit. So we have all these 8 different apartments. So there's female apartments and there's male apartments. So they're even on different sides of the campus. So, they're ever together, and they're not even allowed to sort of be too close during the day as well, because it's just distracting, for all of the clients. But we're very strong in couples.
You are? Okay. Well, I'll definitely round back with you after the call to chat a little about this circumstance, and then
I love that.
this really, it's helpful.
And I'm going to write down your number and send you a text.
I'm glad you said that, because I was talking to Shani about this last week, and I really don't know any facilities that are that set up for couples and really welcome couples in that way. Just because, as Shani and I were discussing, that it can be distracting and also cause conflict in the treatment space. So, I want to come back to a couple of things, that being one of them, how you kind of handle and making sure that that's not disruptive. And I also want to come back about the medical piece, but Malik has a question, so I want to give him space for that.
Jason, that was a beautiful presentation. I applaud you for creating an amazing space for the people to come to, especially the Medi-Cal people, because we usually get, when you're advertising, you get a lot of
Of course.
Medi-Cal calls. Maybe 90% of the people are Medi-Cal
Yeah, of
calls,
course.
and we do send them to the local areas that are closest to us. But
Yeah,
I know that people who are um, in a situation where they are in a familiar setting, which is we're in North Hollywood, California.
right.
Um, they don't want to stay in the familiar setting, so this is a great idea that we could send people over to you guys. The question is, would you provide transportation for them to come to you?
In from commercial payers, of course, it's door to door. We could also, sort of could afford it, if you will. Medi-Cal,
Mm-hmm.
it depends on staff. And, we're not gonna like, call somebody in for overtime to drive across, across California for Medi-Cal because, you know, it's just we have to unfortunately we have to provide the best care, but also balance that with fiscal responsibility. So I
I
wouldn't
know.
say like a blanket statement, yes or no, in terms of providing transport for Medi-Cal specifically, because LA traffic, it can be 6 hours back and forth, and if I have to call somebody from home, but at the same time, if there's staff available, absolutely, why
But
not?
I
Guys,
think
I have a resource I'll drop in the text thread here for exactly that. Medi-Cal has transportation that's covered
Right,
free
right.
of charge to treatment. Let me look that up and I'll send it to you. I'll drop it in the thing. Sorry.
That's
Amy,
amazing.
just
oh, and by
just
the
to let
way,
you,
oh, so
Amy, I'm
sorry.
sorry, Shawnee, Amy, just to let you know, we do accept couples too. That's
Oh,
all.
You
okay.
accept what? What?
Couples as well.
Oh, you do? Okay. And Malik, what's the
Yeah.
name of your program?
I don't mean to hound
No,
you,
it's
Jason.
okay.
Just
No,
LA
no, I
Valley,
just, oh, okay.
LA
Yeah,
Valley
no.
Recovery.
Okay, got it. No, it's actually kind of nice. I like your Recovery Beach is in Orange County, right, Jason?
That's right.
Okay, yeah, I actually think that for this particular couple, it'd be nice to get out of LA a bit, but I'll call you and see. And then the other resource, I just wanted to put it out there, Amy. So I did get a resource that can offer people free phones, free cell phones. So I'm
Nice.
gonna, yeah, so I will pop that in the chat. And really quickly on the couple tip. So it turns out, okay, how do I do this? Let me get back into Teams. I'm in a different section of life here. Okay, I'll put that in the chat in just a minute. It turns out when I Google, I think what it is, Amy, is it might not be popular in Medi-Cal or non-commercial players, but when I just Googled treatment for couples, there's actually a lot of treatment providers that are offering couples therapy. And the one that I met with, 10 Acre Ranch, recently, incredible. I actually want to make an introduction to you because they would be incredible for Recover Well. They have a Native American track where they're white buffalo certified. They, have the medicine wheel track. And the woman that leads that program actually founded a non-for-profit dealing just with Native American drug and alcohol addiction and how that culture is very different. So they incorporate the family. And the way that they do it is it's really kind of like a holistic approach where they say, okay, the addict might have the substance abuse issue, but it's impacting the entire family. And then there's all kinds of like generational trauma they go into with Native American and other tribes. I mean, they treat non-tribes as well, but it's a really interesting substitute for a traditional 12-step program or traditional detox res and they have cottages. So they're set up like as cottages. So I'll send that cell
Yeah,
phone
send
over
that.
to you.
I definitely want to learn more about that. And I think, yeah, if you can get me the information, I'm curious to learn more. What's the name of it again?
It's called 10 Acre Ranch, and the woman over there, I'll send you her details because I was actually making an introduction yesterday. And they're open to it. She got it right away. I mean, after about an hour of us talking, but she's done a lot of work in the space. And oddly enough, she's got her hands, she's got a lot of inroads into Native Americans, Native American tribes, not just the memorandum and officially being able to connect with them, but also she's done a lot of grassroots outreach. So oddly enough, she doesn't have the Shawnee tribe, so that's my first name is from the Shawnee Native American tribe, actually. So I told her I would have to go over to her ranch and see it sometime. But Amy,
Is that
I'll Slack it to you.
California?
What
Is
what?
that in
Oh,
California?
they are. Yeah, it's in California. Here, let me give you their it's
Drop it
in
in the thing because I want to get back to Recovery Beach. I want to
yeah.
point. I want to bring back a point about Recovery Beach and their medical capability. So a couple years ago, when we first started working together, I referred a patient to Recovery Beach. The patient had pretty severe post-surgical injuries, and that was because that patient, if I recall correctly, Jason, you might remember, that
I
patient
do.
had and I confused this patient with another one, had either had a gunshot wound or a stab wound. And that patient was rejected at every facility we referred them to. And believe me, I went way off platform for that because it was a very desperate situation. The hospital was unwilling to keep them because they were stabilized from the post-surgical wound, and the treatment facilities were very apprehensive to take that patient because they didn't feel that they had the medical capability, and it was a big liability issue for them. Jason's facility is one of the highest acuity facilities in definitely in Orange County, but in most of Southern California, as far as I know, because of the medical staff that they have. Can you talk a little bit about that, Jason?
Yeah, I touched on it a little bit, during the call, but we have 24/7 on call medical director, psychiatrist, multiple MPs. We're usually, having a doctor on the phone with a client within a few hours of them arriving at the facility and ordering medication that same day. Our pharmacies, like, within a 2-mile range, they're delivering twice a day medications. Of course, as you know, when it comes to detox medications and MAT, speed to service makes a big difference. So we think we're one of the best in terms of quickly. Then if they're more complicated, we're taking people to doctors, to specialists. We're driving them through the care coordination team to dentist appointments and wound care and urgent care. And when clients are coming to us, they're all mangled up and they have one tooth left, and they're leaving. They look like movie stars. Like all their medical needs that they've been sort of ignoring for years. We're just attacking one after another through the problem list that exists for Medi-Cal provider. We have a kind of a cross between case management and case formulation. It's a Medi-Cal thing called the problem list. So we're focusing on just knocking out as many problems when they're in our care as possible. And again, LVNs, RNs, multiple shifts of these nurses that are able to, we provide injections, we do Sublocade, we do wound care. We're doing pretty advanced and pretty intricate. And yeah, there's very few cases. That gentleman that you're referring to, he had a pretty serious open wound that needed every single day care and in injections and special grafting, and we were able to do that. So we don't shy away from the real complicated detoxes, nor from people that have a pretty serious acuity, whether it's a physical situation or mental. So we're oftentimes taking clients that have eating disorders and schizophrenia and some pretty serious mental health concerns as well, because our team is just very strong in those departments. Our program director is an LVN. She comes from Northbound. So just we're hiring the top of the class, top of the best trained, most proficient people in the people that we can find, basically. Just spending top dollar and just trying to give the best care we can give.
Yeah, and as I recall, that specific patient did really well at the program and ended up staying there for considerably longer, if I recall. And I know that case management at Recovery Beach, as well as the hospital that patient came from, and myself, we were coordinating throughout that stay. All the paperwork, all the labs, all the information that was required, and then also coordinating with the family members who were very distraught. There was a lot going on there. So yeah, so I would advocate for this. Like Shawnee pointed out, that there are these couples situations. This is awesome to know. I wasn't even aware of that. And then the nursing care, the level of nursing care that they provide 24/7 is unparalleled. Definitely in Orange County. And I don't know a lot of places that are offering it that. And to that fact that they have that ASAM rating that's very high, higher than most. So if you've got patients that
Fantastic.
are, go ahead.
No, I was just saying that's fantastic. That's
Yeah, that is challenging because a lot of folks, especially those who've been living on the street and are Medi-Cal recipients, they've been victims of crime on the street. That very frequently I see stab wounds, people who have been really hurt, beaten up, all of their possessions stolen. This is an incredible opportunity. So I'm going to round it out there because we're just a little bit over time here. Does anybody else have questions for Jason before we do the
Nancy had a few questions that she posed earlier that I was just looking over, but
Sorry.
our turnaround time in terms of a response for a referral always happens in the same day. So we don't need a long time. We can make decisions very quickly. We get on the phone with our medical director, our clinical director, if it's a complicated case. Otherwise, our admissions department that's open 24/7 can assess clients and we can admit them in. So same day. And the referrals can go through RecoverWell, of course. You could always call and email directly, Nancy. Either way, whatever is easier at the time, wherever you're at. If you're on the computer, RecoverWell is great. Otherwise, direct is also great. You know, we're very active on the platform, and we're also very active, you know, by phone and email and all the other, you know, methods of communication.
Yeah,
So
and I'll
really,
point out, just so you guys know, per my contracts with the hospitals, if at any hospital that I work with, I am not allowed to give direct contact information for the social workers or the substance use navigators or case managers at those hospitals. I'm not allowed to hand that over to Jason. So if you want to reach out to them directly off the platform, he put his phone number in there. And if you want him to have your direct contact information, that's between you guys, but I'm just not allowed to do that. So I appreciate you guys being patient with me about that.
no, that
Thank you.
makes a lot of sense. And I was just going to add in that in terms of Jason, what you were saying, do you take mental health secondary or is it primary? What's the level of acuity for mental?
Secondary, you know, there's very, very few clients that come through the door that don't have an underlying mental health concern. I would say we're at 90% dual diagnosis in terms of
Okay.
all the patients that we see. But I would say it should be secondary. Again,
Okay.
that sometimes gets like subjective, like what's primary, what's secondary. It's like the chicken or the egg. I'm not sure what came first. And if it is a subjective matter, that's, you know, great. But if it's like serious mental health first and like they smoke some weed sometimes, I would say insurance wouldn't cover them at Recovery Beach.
That makes sense. No, this isn't for the couple I was talking about. I just
No, I
wanted
know,
to have
just in
kind of an
general.
idea. Yeah, in general. And then I'll say like to your point, Jason and Amy, one thing that I found is I actually don't like to go outside of the platform personally because on the referral side, when you're making a referral, it's a really nice HIPAA compliant way for me to keep track of my
Oh, for
clients.
sure.
I don't want anybody slipping through the cracks. And if I keep them, across two different CRMs or whatever it is, or going between the EMR and the CRM and all of that jazz, it just, you can't even zap it in a HIPAA compliant way. So there's no Zapier and there's no way to get it. You have to really have a strong integration. So I might have to make a call occasionally outside of the platform if I can't find what I want. But on that note, one thing that does help me, I know, and I don't know if this is something that everybody else is the same with, but as a commercial, I work for a commercial IOP PHP, and it would be helpful if there were pictures on the platform. I don't know how difficult it is. I haven't yet tried it, but it'd be helpful if if I could see the photos, because I preference the ones that have photos, just out of my not knowing what the other ones look like if I can't easily find them on Google. So I don't
Yeah,
know if it's
usually
difficult.
the commercial providers will put a lot of pictures in there. They have a more dedicated staff to do like that kind of high level marketing. The Medi-Cals are, they're so limited in budget, time, and scale, so they don't always post
Oh,
pictures.
that makes sense.
Yeah. Um, I'm gonna do the raffle and then I'll leave this chat open if people want to continue having a conversation with Jason. But I know that a lot of folks have got this is like their lunch break even. So let me share my screen. Oh wait, I'm not sharing my screen, am I? Let's see. How do I do that? Share screen. Here we go. All right. Okay. Let me just run this quickly. See who we got. A bunch of folks had to pop off, so all right, Beatrice. So I'll reach out to Beatrice and make sure she knows. And then if anybody has any more questions, please feel free to stay on the call and chat
Thank
with.
you, everybody. It was nice to meet everybody.
Nice to meet you too.
Thank
Bye-bye.
you. Thank you so much, everyone. Thank you, Shawnee, for the endorsement. I appreciate that.
Absolutely.
All right, I'll talk to everyone soon. Thank you very much.
Okay, bye.
Bye.